alaikum. My name's Nyrah. I'm a GP pharmacist and I'm your host for today's health show. Now, in today's topic of discussion, we will be talking about females in the healthcare industry, more specifically, female surgeons. Now, I've invited a very special guest to talk more about her journey as a female surgeon. She'll be also giving us some more tips into her career. And hopefully in part 2, we will be touching a bit more on breast cancer. And if we have time, testicular cancer and signs and symptoms to look out for. Scarlett, thank you so much for coming on the show.
Thank you so much for having me. I'm really happy and honoured to be here.
Yeah, I'm so glad. I've always wanted to actually interview a surgeon, so really glad I finally got you on. And I think a nice beginning question would be, tell us a bit about your sort of, as cliche as it sounds, tell us a bit about your current role at the moment and what you do.
Sure, no problem. So for those who don't know me, I'm Dr. Scarlet Nazarian. I'm a surgical registrar in London and also a clinical research fellow, currently undertaking my PhD at Imperial College London. So that means taking time out of my training to do some research, and my research is based on cancer detection, so helping to kind of make improve the detection of cancer in the future, which is hopefully going to be quite useful. And it's actually very interesting. I'm also on kind of social media as the female surgeon, and my kind of aim is to inspire others, especially aspiring young, female surgeons, to follow their dreams and to, be able to get to where they want. And then I'm a general surgeon, so that includes lots of subspecialties, so general surgery, breast surgery, trauma surgery, colorectal surgery. So I see lots of different, presentations and patients as a result, which I love. And I obviously get to operate, which is the other kind of part of what I love doing my job for.
That's amazing. So you've definitely got that experience and that knowledge. And I think you say you specialise also in cancer patients as well. It would be nice to actually talk about cancer a bit more in detail later on. And
absolutely.
Let's talk about the duration of studying. Now, I know when you want to become a surgeon, there's a lot of additional university exams, a lot of different applications you need to make. How did you become a surgeon, for any aspiring students out there that also want to become a surgeon?
Absolutely. It's interesting you say that, because I think surgery is really associated with this kind of long training, and unfortunately in a way it is, but compared to some of the other medical specialties it's kind of similar as well. But essentially you go through medical school. So I did 6 years of medical school, including a year where I intercalated and did a BSc, which is a Bachelor of Science in Pharmacology. You come out of university after 6 years and go into your foundation training, and that's for 2 years. And then that's when you really decide, okay, what do I want to go into? Do I want to go into surgery or medicine? And that's when I picked surgery. And then you do 2 years of core surgical training, and from there you have to jump through more hoops and go through more interviews and exams in order to get your specialist training, or your registrar training, essentially, which is what I'm doing at the moment. And it can be difficult because it's very competitive, but that can last for about 6 to 8 years, depending on what kind of specialty you do within surgery, but does mean that you're in a sort of specific location at that point. So it's a bit easier for when you've kind of settled down, have a family and so on. And then after those kind of 6 to 8 years, you become a consultant. And during that time, whenever throughout that time, to be honest, even whether it's in medical school or after, you can choose to do higher degrees, so either a master's or a PhD, and I've chosen to do a PhD, so that's going to prolong my training by another 3 years. So it's slightly, but we'll get there.
So there's loads of actually different routes you can take. You know, all the options are available. I think it is, like you said, you know, sit down, do the research and see what you enjoy the most. Any
Absolutely.
tips you have for any students out there that want to apply, for example, to get into medicine or to go down the surgery route?
Absolutely. I'd say that my biggest tip is always don't let any myths or stereotypes stop you from what you want to do and what you love to do. And I hear lots of people saying, oh, you need, you know, to be a, you know, gold award winner or merit award winner in order to pursue surgery. That's not true. You need to pass your exams, you need to work hard, you need to focus, and you will get there. So my biggest tip would be to follow whatever kind of career aspirations you have, and if that's in surgery, then you will get there. So don't let other people kind of pull you down with you know, as it were, the stereotypes and myths that exist.
Definitely some brilliant tips and advice there that can apply to any career path, really. You know, perseverance, staying positive, you know, and always going ahead full steam, you know, kind of end goals. And you mentioned myths. You know, what sort of myths have you kind of addressed, or, you know, you've kind of seen and you're like, oh, hold on, that's completely not true?
Oh, so many. So, first of all, as I kind of touched upon, the fact that you need to be like have awards and merits and, you know, be top of your year in medical school in order to be a surgeon. That's not true. You know, I went to uni, passed all my exams, wasn't a merit award winner, wasn't, you know, a golden award winner or anything like that. And I'm here today doing what I love. The other myths are that it's very much male dominated, which is actually true. Unfortunately, only 13% of you know, consultant surgeons are women in surgery, and we do need to increase that, but it is increasing and it will take time, but hopefully we'll get there. The other one is that it's just really kind of competitive, and I'd say that that's also not true, because actually if you take lots of the other specialties within medicine, so rheumatology or dermatology, they're actually much more competitive than surgery. So although surgery may appear competitive, if you want to get there, if you work hard, you can do it.
Definitely, you know, that's very interesting to hear, actually. And I was reading online actually the other day that apparently more than a quarter of female surgeons out there actually receive a discrimination. And now that's a really interesting statistic. And I was wondering, how's your experience been like as a female in that sort of surgical environment?
I've been very lucky. I think that you know, of course there is discrimination there, and unfortunately things need to be done to change it, and I'm always advocating for change, especially on my social media channels. But you know, I've been lucky in that I haven't had to be in a position where I haven't been able to get the same opportunities as male colleagues, but there's always, you know, sexist comments, or you know, you'll find that a male senior will, you know, turn to the male person in the group before you, even though you're more senior. And I think this is the kind of attitudes that we need to change. I also think I'm a big kind of advocate for changing the stereotype or myth that females can't also have a family and do surgery, and you can't have a work-life balance, and you can't, you know, be able to essentially be a woman, you know, doing your job and having a career. And I think that's really important. And that comes with like years of people being like, oh, you know, you have to, but you can't have babies and also go to work, you know, you need to be at home. That's not true. You know, you can do whatever you want, you can be whatever you want, and you just need to try and squash those, follow whatever path you want, whether that's having children or not, and then let everything else kind of fall into place. And again, things are changing within surgery to allow that.
Definitely. And one thing I really like about your social pages and your whole message, Scarlett, is that you're really encouraging young females to actually, go ahead and pursue that career within, that medical profession. And that's really important, that you're kind of breaking the whole myths surrounding females in healthcare as a whole. Because that work-life balance, it is super important. Even, for example, same in pharmacy as well. A lot of people think, oh, community pharmacy or in the shop 24 hours, you won't actually have a social life. But a lot of the times that's actually not the case, especially, my role within primary care. And now we will actually be coming towards the end of part one. Scarlett, thank you so much for joining us for part one. Part two, we will actually be discussing more in detail pros and cons about being a surgeon, and also kind of just hopefully we get time to touch on both breast cancer and testicular cancer. Thank you so much for watching part one. If you do have any questions, you can always message the number on the phone screen. If you missed part one, don't worry, we always have a repeat on our YouTube channel. Thank you so much for watching, and catch you really soon after the break. Welcome back after the break. My name's Nyrah and I'm your host for today's health show on British Muslim TV. Now, in part one, I introduced our lovely guest, Scarlett, who is a female surgeon and a female advocate as well for the actual career. Hi, Scarlett. Thank you so much for joining us again.
Pleasure.
It would be nice to actually just kick off part two. I know a few more questions and topics I actually wanted to cover with you in so little time. Wanted to actually just jump in there and ask you, actually, what do you enjoy most about being a surgeon? Let's go through the pros and cons. I think this is going to really help out the students that are watching there, or even the parents that want some of their students to actually go into this sort of career.
Absolutely. So the reasons I love my job is, one of the biggest ones is the interaction that I have with patients. So I love, being able to talk to a variety of patients from a variety of backgrounds who present with lots of different presentations, obviously most of them being for surgery. I also love working as part of a team in a hospital environment, and especially love working with both teams on the wards and also in theatres. And in theatres, of course, we have like scrub nurses, we have HCAs, we have anaesthetists, we have radiographers, we have a variety of people that, you get to have that kind of added interaction with, which is fantastic. I obviously also love the operating. I wouldn't be a surgeon if I didn't, and I love the technical aspects of that. But I also love the challenge and the both the kind of intellectual challenges that it surgery provides, but also operative. You're in the middle of an operation, and the anatomy is slightly different in every person, and it's down to you to be able to kind of work it out so that you're providing the best outcome. So those are some of the reasons I love it. I think that some of the downsides can be, obviously, it's a huge responsibility, especially in surgery, where you are, responsible for that patient's life at the end of the day. And if things go wrong, then, it can go down the kind of negligence, paths, and that's what we try and avoid. But it's, and the other thing is that it is, as we've touched upon, kind of long hours, and that can be quite difficult, especially if you have a family at home that you need to get to, as well as the long kind of training, as we've discussed as well. So there are some cons, but I'd say that even if it is long hours, actually it's probably better than some of the other, so law or being in finance sometimes, because you do have a set rota and set timings. So you've got to kind of take everything with both sides and with a kind of full perspective on it.
Definitely. I think the beauty of healthcare, as you mentioned before, was, the teamwork involved. And it is that really rewarding career pathway. And we mentioned work-life balance in part 1. Now, I know shift patterns for medics can be really daunting sometimes. And COVID must have had a really big impact on a lot of surgeries. Were a lot of surgeries cancelled due to COVID? How has COVID affected your work-life balance or day-to-day work?
So yes, COVID, had a big impact, I think, throughout healthcare, and in particular in surgery, it had a huge impact on elective operations. So, those that were waiting for a hernia repair or for their gallbladder to be removed, and that weren't, a life or death situation, that weren't an emergency. So all of those had to be postponed, and unfortunately, patients had to essentially wait longer than they would have had to. We did, however, carry on with important operations that were almost, life-threatening. So obviously, essentially any trauma cases within kind of orthopedics and stuff, and then within general surgery, all the cancer cases. So, colon cancer, breast cancer, all the other different cancers carried on. Obviously, this was all made slightly more difficult because of virtual clinics and patients not being able to turn up to their operation because of catching COVID and so on. So it was a bit of a balancing act, but yeah.
Yeah, no, it's been really difficult. I think the good thing that the NHS has in place is that 2-week cancer referral process. The faster you detect the symptoms, the better across all stages of the actual disease. And talking about cancer, let's talk about breast cancer. So I know you've worked with a lot of breast cancer patients before. What are some of the key signs of breast cancer all women should really look out for?
So I think that the more we talk about breast cancer, the better, firstly. And just to mention that breast cancer can affect women, but it can also affect men. And a small proportion of men are diagnosed with breast cancer every year. So really important for the messages almost to be, of course, be told to women, but also to men. It can also affect people at any age, and cancer doesn't discriminate. And so it's important to be aware of the signs and symptoms of breast cancer. And these include a new lump or thickening in the breast or in your armpit, a change in the size or the shape of your breast, a change in your nipple, so whether it's kind of inverted inwards, or a new discharge from the nipple. It also includes any puckering or dimpling of the skin. So if there's any changes that are new and don't feel right, it's really important to see your GP and to get a referral. And most of the time, new lumps, for example, are benign, i.e. non-cancerous, but it's really, really important to be able to go to your doctor, have the investigations, and essentially have your mind put to ease.
Definitely really key red flag symptoms that all women have to look out for. And how often should women actually check for their symptoms, or just generally check their breast for any lumps?
So there's no actual kind of set time that's recommended. We say the more you check, the better, and the more regularly you check, the better. I always say on my Instagram page, set a reminder at the beginning of the month. So the first of the month is a fantastic time. And then that way you just know, oh, it's the first of the month again, time to check my breasts. And you can also do it, other times, whenever is comfortable, either before bed, during showering, whenever you have an opportunity, I think, check your breasts.
Yeah, definitely. And the most important thing is the faster you actually detect any sort of lumps, it's really important they actually speak up about it and patients actually see their GP when they can. And in terms of actually having an operation for breast cancer, you know, how successful is that for most of the breast cancer patients? There's been a lot of advancements now in technology and treatment.
Absolutely. And the more studies we do, the better we get in knowing what gives the best outcome. Cancer surgery within breast is really dependent on the type of, well, it depends on what sort of symptoms you have. But if it is a breast lump, then it depends on the size of the breast lump, where it is on the breast, whether it's central or on the side, and also whether any lymph nodes are involved in the armpit. And so the two main kind of breast surgical procedures are either what we call a lumpectomy or a wide local excision, in which we just remove the lump and surrounding tissue so that we remove as much of the cancer as possible, or we do a mastectomy, which is removing the breast itself. And then with that, it may or may not involve removing some lymph nodes as well in the armpit. So yeah. And all of these are, of course, you know, evidence-based and dependent on the individual.
Definitely. So it's always a patient approach, patient personalized approach, rather than just kind of like a one size fits all. No, that's brilliant to know.
Exactly.
Perfect. And I think we are coming towards the end of the show very soon. Is there any kind of last sort of topics or any myths you want to kind of address? Feel free to share your Instagram as well.
Yes, I mean, you can find out lots more information on my Instagram at The Female Surgeon. I also have a TikTok as well, and I'm always very keen to answer. I do some Q&As to answer any questions on there. So whatever topics you may feel we haven't covered today, I'm very happy to cover on there.
Oh, that's brilliant to know. Thank you so much, Scarlett, for actually coming on the show. You've been a wonderful guest. You know, you've answered all the sort of questions that would help out a lot of students out there. And thank you so much. And if you have missed, thank you. And if you have missed part 1 and part 2, you can find a repeat on our YouTube channel. Definitely go out and check out The Female Surgeon on both Instagram and TikTok. She posts a lot of educational and new videos. My name is Nyrah and I'm your host for today's show. See you next week. We'll be talking about skincare. See you and good night.